Thank you. Good afternoon, everyone. Welcome to this West Berkshire Health Scrutiny Committee. I'm Graham Pass, Chairman of the committee. I'm supported by Alan Macro on Zoom, so he can participate but cannot vote. And other councillors in the room with me are Councillors Jeff Beck, Tony Linden and Andy Moore. Councillor Graham Bridgman is also present as the Executive Portfolio Holder for Health and Wellbeing, again on Zoom. Welcome, Graham. Council officers and external partners joining us to advise us are Paul Coe, who is our Interim Executive Director of People. Welcome, Paul. Sarah Webster, Executive Place Director, Berkshire West Place from Buckinghamshire, Oxfordshire and Berkshire West Integrated Care Board. In future, I'll call you Bob, if I may, Sarah. And Fiona Warby, Chief Officer from Health Watch West Berkshire. Hello, Fiona, I see you on Zoom as well. I hope you can all hear us. Good, I'm getting nods, so I'm taking that as a definite. When it's your turn, if you could unmute and we will hear what you have to say, of course. I also have Kevin Tallett, Improvement Programme Director, South Central Ambulance Service, NHS Foundation Trust, to give him his full title. Ben Voller, Clinical Operations Manager, South Central Ambulance Service, NHS Foundation Trust. Alison Foster, Programme Director, Building Berkshire Together Hospital Redevelopment. And aided and abetted by Vicky Phoenix, who's the clerk to the meeting, to keep me on the straight and narrow. The meeting is being live streamed via YouTube, and Gordon Oliver is our Zoom host. Before we start proceedings, I'd like to explain, for the benefit of any members of the public who may be watching, that today's meeting is held both over Zoom and with councillors present in the council chamber. So the meeting is being live streamed so members of the public can follow proceedings. And during the meeting, as I just said, if anyone wishes to speak, if they could raise their Zoom hands. All voting will be done from those in the chamber by the raising of their actual hands. So if we hear an evacuation alarm this afternoon, we must leave the building immediately via the emergency exit. The assembly point is a Dolphin car park opposite. And if the lockdown alarm sounds, we'll remain seated and await instructions from our officers, and we'll adjourn the meeting until such time it's safe to proceed. Any questions, anybody? I think we've been through this a few times, so yes. Right, first of all, item one, apologies for absence. Vicky, we've
received no apologies, yeah. Chairman.
But Alan, I understand that you couldn't make it in today, so you're welcome on Zoom. Item two, members, minutes to confirm the minutes of the meeting held on the 13th of December. Can I approve those as a true and correct record of the meeting? May I proposal? Councillor Linden. And right, thank you, Councillor Moore. I'll sign those and pass them to Vicky. There you go. Item three, declarations of interest, members. Sure, Councillor Linden.
Yes, Chairman, I'm going to be raising some pharmacy issues. One, I use the Burfield pharmacy, and the other, I've been advised that the Sainsbury's, the Lloyd's pharmacy in Sainsbury's Calca is in my ward.
Okay, thank you. Councillor Beck. Right, thank you. Well, I will not be raising any questions about the one I use. Councillor Macro.
I use the pharmacy in Thiel, which would be affected by the Sainsbury's pharmacy closure.
Okay. Noted. Thank you very much. Item four, petitions. Vicky, do we have any petitions?
We've not been notified of any in advance of the meeting, Chairman.
Okay. In that case, we come straight to one of the main items, item 5, which is the pharmacies. Now, I can welcome Themba Malanga, who is here. Are you connected to us on Zoom now?
I'm not so sure, Chair. I've got Sorry,
Well,
I'm not so sure, Chair. I've got a screen going at the moment, but I'm not so sure whether everyone can see me on it.
oh, I can see you. Yes, I have got
Okay.
you there now. That's perfect. And I see that Councillor Moore is helping you. If you could talk through the microphone, we can hear you perfectly well.
Thank you.
And then it is all live streamed as well. So welcome to you. And David Dean, I see you're on Zoom. I don't know. Well, I'm going to ask Themba to give an overview to the report and invite questions. Then, David, if you would like to give any report that you wish to give us, and then we can ask questions of both of you. Is that okay?
That's fine, Chair.
Okay, right, excellent. Right, well, Themba, over to you.
Well, thank you very much, Chair, and thank you very much to the committee for inviting NHS England Southeast to this afternoon's meeting. I'm sure members will have seen and read through the papers and the package that was sent last week. There are three components to the deck of slides that members have received. So the first element, or the first three or so slides, covers the overall context within which community pharmacies function. The second element covers the elements relating to the pharmaceutical needs assessment and the roles and responsibilities of the health and wellbeing boards. And then there is a third element of the slide deck, which relate to West Berkshire specific pharmacy issues. So I do not intend to read through or regurgitate the information contained in the slides, but we'll work through the key highlights of each section of the report. So we can spend a bit of time on the question and answer session around specific questions that committee members may have. So the first few slides, as I've said, they outline the context with which community pharmacies function. So pharmacies do not have a contract specific per se for the individuals, but they come onto a pharmaceutical list and they are regulated by the pharmacy regulations of 2013 as amended. So they operate according to a pharmacy manual, which provides them the instructions and the processes that they need to follow to adhere with their terms of services for their business as usual. Health and wellbeing boards are responsible for assessment of the pharmaceutical needs in any area. So for West Berkshire, that responsibility falls to the West Berkshire Pharmaceutical Needs Assessment. It's also worth pointing out at this point that from the 1st of July in 2022, pharmacy commissioning functions were delegated to integrated care boards. And for the purposes of this part of the Southeast region, the delegation is to the Berkshire, Oxfordshire, and Buckinghamshire board, which is Bob. So for the contractual context that the pharmacies function in, they are required to provide essential services, and these include dispensing or any repeating services, public health collection. But they also provide a suite of other elective services, which we commonly refer to as the advanced services. There are also, some of them may provide enhanced services that are locally commissioned. So for instance, like for the provision of pharmaceutical services during bank holidays, those are some of the things that are commissioned locally. There is an overarching contractual framework, contract framework that covers over a 5-year period. And we are now into the 5th year of that framework, which really sets out the direction of travel over a 5-year period and the expectation of any new services that pharmacies will be expected to provide. It basically seeks to connect community pharmaceutical services provision to the entire primary care services suite. So as I've mentioned earlier on, the health and wellbeing boards will be responsible for the pharmaceutical needs assessment. But in terms of ensuring these in adherence to the market entry process, that falls to the commissioner, in this case, the BOP ICB, working through a pharmaceutical services regulations committee. And they will look at the different market entry applications. If it's for new entrants coming onto the pharmaceutical list, they will also look at any applications to consolidate or when either two pharmacies of an existing stable or there could be two pharmacies from different stables who are coming together for one reason or the other. The committee will also be responsible for any relocations, any changes of ownerships as well. In terms of the mid part, after they've been on to the pharmaceutical list itself, community pharmacies then are assured on a regular basis to check that they are adhering to their terms of services and that they are adhering to the requirements of the pharmacy regulations. This primarily happens through an annual cycle of the Community Pharmacy Assurance Framework. It's a self-regulatory mechanisms that all community pharmacies must adhere to. It has a three-stage process. The first stage is for those pharmacies to complete a short 10 questionnaire. And then depending on the question, on the responses that they provide to those questions, some of them may be selected then to complete the long questionnaire. And again, depending on the questions that they provide, some of them will be asked to complete the full questionnaire. Those who complete the full questionnaire tend to be those that will not have completed the short questionnaire, or those that don't complete the long questionnaire itself, or those pharmacies that over the year, the pharmacy teams will have identified concerns or issues, and therefore will have been put forward to complete the long questionnaire. Then the third part of it actually is a visit to some of those community pharmacies. I must just point out at this point that there is no expectation that we will visit all the pharmacies across the Southeast. I think we've got something like 1,500 pharmacies on the list. But the parameters of framework is that we visit at least between 1% and 3%. Now, with the staff complement only about 9 in the team across the Southeast, we tend to work like at maybe 1%. And the visits that we carry out will be risk-based. So we tend to direct the resources to those pharmacies that we believe could use with a visit. But over and above that, there is the business as usual process of responding to concerns, either from public or from other pharmacies about any concerns that they may have with community pharmacies. There is also another NHS body that then looks at other assurance processes during the year, the NHS BSA. So they will carry out other separate proactive assurance visits or requirements of pharmacies. This could be either about their claims or prescriptions provided, or in the last couple of years, they have carried out verification exercises in relation to COVID. Some of you may be aware that during the pandemic, pharmacies were contracted to provide delivery services for shielding patients, and the NHS BSA was responsible to ensuring that those services were provided for the people who needed them, and that any claims that were submitted were rightfully made. And then the end part of the cradle to the grave process, as it were, around pharmacy commission is when pharmacies exit the market. So it's basically 3 ways in which they exit the market. So if they decide that they do not want to be on the pharmaceutical list itself, they can then decide to do so. There are requirements in terms of notice periods that they need to give. So if it's a pharmacy contracted to provide 40 hours, the requirement is for a 3 months notice. But if it's 100 hours, then the requirement is for a 6 months notice period. There may be variations to that notice period, but those need to be agreed with the commissioner. So the other way would be through consolidation. So two pharmacies decide to merge into one, and therefore one pharmacy will be removed from the pharmaceutical list. Another way in the unfortunate event is when pharmacies have to be removed from the pharmaceutical list. And that's really the other end of the spectrum. So if the pharmacy has perpetually been delinquent, or there are certain concerns about those pharmacy and they've gone through the dispute resolution process and there is no resolution of those matters, a pharmacy may be removed from a pharmaceutical list. I should say in my 6-year period with the NHS England, we've never had a pharmacy removed from the pharmaceutical list. The next section really belongs to the Health and Wellbeing Board for this area. But I just want to speak through that briefly as well, because we don't own that, but it's a process that's owned by the Health and Wellbeing Board. So what we've provided in that slide really is the summary that we've extracted of the pharmaceutical needs assessment for the latest PNA for Berkshire, which was published in October 22, and it will run for a 3-year period. So in the summary that we've given in there, probably of interest to the committee is the executive summary conclusion that by and large concludes that there are no gaps in pharmaceutical services provision in the area, either during normal working hours or outside working hours, or even for the various services that are provided by pharmacies. I guess maybe at their own leisure, committee members may want to see the level and the nature of the public engagement that the Health and Wellbeing Board went through. We've also provided basically a summary for this meeting in slide 8 that gives you an idea of, in terms of accessibility, in terms of the opening hours as well. I just want to move on to probably an area of more interest to the committee really, which is more West Berkshire specific. Towards the tail end of 2022, there were challenges in and around Thurcham and Pangbourne. Specifically, the issues in Thurcham related to the Lloyd's pharmacies. So the Lloyd's pharmacies in Thurcham, they went through a period of severe staff shortages towards the tail end of December, resulting in those pharmacies being closed at certain times of the day. There were also issues with Boots Pharmacy, which were not about closures per se, but it was more around access to that Boots Pharmacy. And this was because of the closure of a link way between the Boots and the Thurcham GP practice. As for the Lloyd's pharmacy issues, those have been resolved by and large. Lloyd has managed to recruit staff to those pharmacies. And at our last meeting with Lloyd's, which was, we have weekly meetings with Lloyd's, and the last one was on Friday. I can say that the Lloyd's have told us that those 2 pharmacies are operating as expected, and they are fully open. I'm sure David will speak to this from an LPC perspective in a second. Similarly, again, with Pangbourne, there were issues again with Lloyd's, again related to staff shortages. On a general point, I should say that there have been significant staff shortages across the pharmacy sector, not only in the Southeast, but nationally as well. The situation was and has been severe since around May this year. But what we are seeing from beginning of January to date is a decline in those closures resulting from any workforce shortages. Primarily, it's got something to do with people moving out of the sector itself totally, leaving the country to go and work somewhere else, but also as people move on to other sectors as well. Some pharmacies have moved to GP practices, and some have moved to primary care networks as well. So those have resulted in a significant number of closures, not only with Lloyd's, but other pharmacies. So in those instances where pharmacies have to close, the regulations are very clear in terms of what they need to do. They must inform the commissioner as soon as possible, and they must give a reason to why they've had those closures. And there's a whole suite of actions that they are expected to then activate to ensure business continuity. And the LPCs in David Dean's office work with ourselves to try and support the pharmacies if they are facing any of those challenges arising from those from any of those closures. Probably of current interest now, not only in West Berkshire, but across the Southeast and England in general, is a decision taken by Lloyd's pharmacies to close all their Lloyd's pharmacies in Sainsbury's. It's a corporate decision taken by Lloyd's for various reasons. And in West Berkshire, there's 2 pharmacies targeted to close on the 22nd of April. So just in about 6-7 weeks' time, those 2 pharmacies will close. The one in Bath Road, and there's another one in Hector's Way. So Lloyd's have been in constant discussions with ourselves. As I've said, we have weekly meetings outside these closures, but just weekly meetings with Lloyd's to understand all the actions that they are taking to ensure that there is sufficient information being communicated to the public about what they need to do in terms of their pharmacy nominations, in terms of communicating the closures with their GP practices. We've also had a couple of sessions with the health and wellbeing boards across the Southeast, just to speak to them about the implications for these closures, to their pharmaceutical needs assessments, what they need to start thinking about, whether those gaps will result in any closures, and the actions that they will need to take subsequently to any of those closures coming on board. And finally, Mr. Chair, you will have in that slide deck the listing of all pharmacies in West Berkshire, and also a listing of the services that they provide. So we haven't listed the essential services on there because all pharmacies must provide those as part of the regs. But what you've got in that slide deck is the names of the pharmacies and the advanced services that they provide. So by and large, what that slide, the last slide deck gives you is an idea that generally from all the suite of services that we expect community pharmacies to provide, West Berkshire is fairly well covered for in the various sectors. Thank you, Chair.
Right, well, thank you very much, Themba. You've highlighted really why we have brought this topic to this scrutiny panel. There were great concerns from local residents in Thatcham, and indeed the customers of Sainsbury's who access those that they have heard were going to close within the store. I'm happy to, if there are specific questions to Themba on his presentation, I'm happy to take them now. Otherwise, I really would appreciate David Dean saying what he wishes to address. First of all, Councillor Macro, is that a legacy hand, or do you wish to ask Themba a question now?
It was a legacy hand, actually, sorry.
I thought it might have been. Councillor Linden, is there a specific question?
Yes, there is,
Okay.
and I'll make a quick free comment as we did at the pre-meeting. Yes, I would like to ask you about Calcutta, Sainsbury's being shut. There is obviously a pharmacy in Thiel and in Burfield, which is a further distance away. And there's also Asda and Honey End Lane in Reading Borough. But it does cover 4 councillors, that ward. So 2 wards of West Berkshire, and that is over 10,000 electors. So we're talking 12 to 13,000 residents, because as you say, it's going to be shutting on the 22nd of April, and Sainsbury's doesn't want to replace that with their own pharmacy, which they used to have before Lloyd's arrived. There is also a Boots pharmacy in that site, and there's some question whether what the future is on Boots there, I don't know, but they do actually have room in that shop to provide a pharmacy services. So the question I'm going to ask you is, there's 2 ways. One, we could ask if Boots are prepared to bring in a pharmacy, or that we could get pharmacists in to use that location to provide a pharmacy service for those 13,000 plus residents. So if I could ask a question on that, please.
Thank you, Councillor Linden, for that question. I should point out that the Sainsbury's pharmacies, despite being located in superstores, the volume of items that they do is very small. So I think for when I last checked, the Calcutta one, the Lloyd's and Sainsbury's, their dispensing items is something like 895. So it's not a huge amount for a pharmacy, given the fact that like some pharmacies will be doing in the volumes of the 5,000 to 6,000. That doesn't mean this store is not irrelevant.
Or a month?
Yeah. Sorry.
Is that a year or a month?
No. That's on a weekly basis. Yeah.
Okay.
So they are very small amounts that they actually do. But as I say, it doesn't mean the pharmacy is not required. Whether actually Boots will want to open another pharmacy in there. As I've said, the entry into the inclusion into the pharmaceutical list, by and large, relies on what the pharmaceutical needs assessment says. So if the Health and Wellbeing Board determines after the closure of that particular list in Calcott or the one in Hector's Way, that a gap has arisen as a result of that closure, they will issue a statement to that effect, and then the market will react to that statement by submitting a market entry. So it cannot be a proactive decision by Boots or any other interested party that they would like to or want to open a pharmacy in there. It will be in reaction to whatever the Health and Wellbeing Board assesses the needs to be in that area.
Thank you, Chairman.
Well, we can come back to that, Councillor Lind. I'm very keen to bring David Dean in, but I see Councillor Bridgman, who is the chairman of the Health and Wellbeing Board. Councillor Bridgman.
Chairman, I was indeed going to wait for Mr. Dean, but given what's just been said, I thought I'd pick up a couple of things, if I may, and it may well be Mr. Dean wants to pick these up and we'll all come back to them in due course. But a couple of things. Firstly, the data I've got indicates that Calcott dispensed, in November 22, Calcott dispensed just under 5,000 prescriptions in that month. 60-odd% of those were for Thiel, which doesn't surprise me at all. I used to live very close to that site, and we used Thiel and that is the sort of practice that most of the residents on Ford and part of Ford and all of Beansheaf will use, I suspect. So that's not surprising. I just wanted to pick up this question of the role of the Health and Wellbeing Board. We will be having a meeting later on in April. And one of the things we will be considering at our steering group meeting as to whether or not and how to deal with it on the agenda will be the pharmaceutical needs assessment, and whether or not we need to address the question of a supplementary statement or something else to address few issues, particularly and principally the removal of Lloyd's out of the two Sainsbury's sites in Newbury and in Calcutta. So just to put that in context as to whether or not some form of supplementary process will come forward. The question I would then have, and it will be the question for both representatives of the pharmacy, is okay, where do the Calcott residents go, principally Calcott, if Sainsbury's is no longer offering a prescription service? But I do fundamentally take the point that most of the operation of Lloyd's in Sainsbury's in Calcott is not to do with filling prescriptions, it's to do with general pharmacy pieces and all that goes with that. Because there are, and I note what Councillor Linden said, I think there are at least 5 pharmacies within a 2-mile radius of Calcutta, and you've seen the reference to 2 miles in various other places as to accessibility. So, Chairman, the fundamental question I have out of the back end of this, and this is not to preempt any of the discussion at Health and Wellbeing Board, nor to preempt any kind of decision Health and Wellbeing Board might make about the need for supplemental to the pharmacy needs assessment and so on and so forth. But if and when there is an identified under availability, I can't think of a better word, for pharmacy services, what does the NHS do about that? I mean, you can't just invent pharmacists. You can't just force people to come into the market. So the question really is, what can be done about that? No, absolutely, Mr. Dean will speak to that, but I just thought I'd frame that question because I think it is part of the scrutiny piece that Health and Wellbeing Board will also be interested in. Thank you, Chairman.
Right, well, thank you, Councillor Bridgman. I'm good. Councillor Macro, is it relevant? Sorry, I'm sure it is relevant. I know you well. You only make relevant points, but I'm very keen, as I keep saying, to bring David Dean in on this. He's already got a big question to answer.
Yes,
Can you assist? But I'm really concentrating on the presentation we just had.
It's a quick bit of clarification from Councillor Bridgman, actually. When you said the majority of prescriptions issued by Sainsbury's in Calcott was Thiel, I presume you mean the Thiel Medical Centre rather than Thiel Residence.
The Thiel Medical Centre, precisely that. Thank you, Councillor Macron.
Thank you.
Right, I'm going to pause now for David. Could you tell us what you want to tell us? possibly, hopefully answering the question Councillor Bridgman posed to you as well. So over to you.
Thank you very much, Mr. Chair, and thank you everybody for inviting me to this meeting. The LPC is a non-profit statutory body that represents all community pharmacies across England. So our LPC Thames Valley represents 250 pharmacies across the whole of Berkshire and the whole of Oxfordshire. And obviously for you in the room, the 20 pharmacies that currently reside in West Berkshire. I just want to put into context maybe the reasons why Lloyds has decided to exit the market. And obviously, you know, it's a last resort that any owner or any pharmacist wants to close a pharmacy. But I just want to make it known that the immense financial pressures that community pharmacy is under at the moment, we're running under a contract that was negotiated 7 years ago that has stayed static financially for that length of time. So in real terms, it's declined by some 30%. Added to that, there's been a massive increase in workforce costs, energy costs, and costs of supply of medication. And indeed, many items that are dispensed at a loss in the pharmacies across the country. To supplement that income, the government has quite wisely asked pharmacy to step in and help with increased services, which we gladly deliver. But that has meant over the last 7 years, we've been doing more work for exactly the same amount of money. And obviously through the pandemic, community pharmacies remained open. And as the only port of call for healthcare for many residents of West Berkshire, delivering thousands of COVID vaccinations and many more thousands of flu vaccinations, protecting the vulnerable in West Berkshire. So the big question really when pharmacies close is why they close, and obviously financial viability is a big part of that, but what happens when they close? Obviously there's an impact on local residents. I fully understand that. You know, we all have come used to using our local pharmacies for many things, but unfortunately the core reason why would any pharmacy in their right minds want to open a business in the current financial climate? And that's the question that every pharmacist will be asking themselves over the coming years. And the best we can do is to protect the 18 pharmacies that are left behind in West Berkshire. And opening new pharmacies to replace the ones that close could be the last straw that sees the end of other pharmacies in the West Berkshire area. So fixing one problem may cause many more down the line. And obviously that's up to the Health and Wellbeing Board to decide when they look at the P&A and consider whether a supplemental statement gets added to that document. And that's it from me, Mr. Chair. Happy to take any questions.
Thank you for that. And I confess, if I was looking at it on a personal level, as you've just described, would I want to do more work for the same money or more work for even less money? And the answer clearly, well, you can guess what the answer would be, wouldn't you? But having said that, we are being directed as patients to ease the burden on doctors' practices by accessing pharmacies for advice, for minor ailments. And I'm quite shocked when you say that they're effectively, I believe, from what I understood, to provide that service for, do I get it, that no extra pay? And I'm also quite shocked that you're dispensing at a loss, where I thought that, to put it bluntly, the NHS, I appreciate there are certain medications that are very expensive, and there is a standard flat rate fee for prescriptions to be dispensed, and dispensations for those who don't have to pay. But I'm quite surprised, therefore, how you can dispense prescriptions at a loss. Could you elaborate slightly for me?
Absolutely. Well, fundamentally, the supply chain is broken in pharmaceuticals at the moment. So some prices are rising faster than the government can pay pharmacies to deliver. So there may be a month when a certain medication costs £30 to the pharmacy, but they only get compensated £25 by the government. And that price list changes day in, day out. And indeed, many hours late into the night are spent by many pharmacists trying to find the best price for products that they can dispense to their patients. And it's one of the very few industries where they can't put up their prices because those prices are paid by the government. It's a very, very complicated funding model, but basically pharmacy costs the government £2.6 billion a year to pay for everything. And that amount has been the same now for 7 years. So where we dispense more items and do more services, we get paid for those services, but the amount in that, what they call the global sum, remains the same. So the more pharmacies that do things, the less everyone gets paid. So it sounds like a strange funding model. And maybe 7 years ago, it was the right funding model, but who knew there'd be a pandemic and who knew we'd be in the middle of a cost of living crisis. So we are today, asking the government time and time again for increasing funding to deliver more services to patients. You're quite right, to help out our GP colleagues and our colleagues in A&E who are overwhelmed as much as community pharmacy are, but they just won't pay extra money for that service.
As you say, it's a very strange funding model indeed. I'm wondering whether there should potentially be other pressure put upon government to try to assist in re-establish. I think that's going beyond our remit at this board, but you've certainly given us food for thought. And I thought I knew a little bit about how it works, and I've discovered how little I know. So I'm grateful to you for that information. Councillor Linden.
Yes, thank you very much for the pair of you. But I forgot to mention, of course, the Meadway in Reading Borough, and I think it is also increasingly important as we're involved with Buckinghamshire, Oxfordshire and Berkshire West. And this is a Berkshire West matter, obviously, across the boundary with Reading Borough, which we work on health, and we also work on other things as well, like planning and housing and highways. So strategic planning. So really, one other thing I was really referring to is staffing levels, which we discussed in the pre-meeting. And a couple of things. My local pharmacy in Burfield, for instance, it's owned by a company in London, and they tend to get pharmacists from London. And quite a lot of them usually don't want to stay driving into Burfield all the time. I know it's Councillor Bridgman's ward and it's a lovely place, but when you're getting somebody in with the roads and how to get there with congestion, all the rest of it, and accidents we have continuously on our roads, that's going to be a problem. But whether we can work generally, David, with other pharmacies to make up for having, when there are missing pharmacists, that we could have locums with companies working together, collaborating on there. It would ease the crisis, because there is a problem whether you're working in retail or hospitality or other sectors. I mean, we've got a lot of agency staff in the council, especially in adult social care. So there is a shortage of people, and I know the government's fully aware of that because the media prompt them all the time. So this is a real problem, and I just wondered where we are moving, and maybe Sarah can come into that on this, because as a commissioner as well.
Right, David, can you pick up any of that? And I'll come to you, Sarah, as well.
Yeah, we obviously encourage our contractors, our pharmacies, to work together where possible. But the locum market is a separate commercial entity, if you like, and they tend to compete for hourly rates, and they've been driven up. They're almost double what they were about 3 or 4 years ago. The good news is that the workforce crisis is abating slightly. We've been working hard with Health Education England now for a number of years to encourage the number of entrants into the pharmacy world to increase. And we think the quality of pharmacists coming through has improved immensely. And we're working with our colleagues in Bob ICS across sector with hospitals and GP practices to try to share best practice. But I will add that the formation of PCNs, 2-3 years ago now, took 3,000 community pharmacists out of the market, which is another contributor to the problem. That's happened. So we're doing the best we can to try to fill the gaps behind it. So workforce is an issue, has not a big as issue as it was, but it isn't likely to improve immensely very quickly. But working as hard as we can with the help of Sarah and her team.
Sarah, can you add to that?
Yeah, but thank you, and thank you, David. I think that's been a really helpful summary. I would say that so as we move towards more local commissioning of this through the ICB, we want to build on the extremely constructive work that's already been undertaken and find those opportunities where we might be able to work differently across the sort of Berkshire, West Oxfordshire and Buckinghamshire, including commitments such as when we are recruiting into certain posts, we make sure we aren't poaching from each other and robbing Peter to pay Paul, for example. So I won't go into more detail because I think we'd spend the whole meeting talking about this otherwise, but it's a commitment that this is an area we're looking at and working with partners on to come up with the best solution for our residents.
Thank you, Jim.
Well, that's a helpful comment, Sarah. I'm personally absolutely convinced that you are all, of course, working to the best answers that you're trying to get. I see that Councillor Moore and then Councillor Beck need to want to enter the debate. Councillor Moore first, then Councillor Beck.
Thank you, Chairman. Yes, I don't know quite who I'm really addressing this to. Perhaps everybody that's spoken, but I just wondered what the impact of, if you like, medications by mail order is having on pharmacies, local pharmacies, and whether that's a positive thing that we should be pushing and making sure people are getting their medications, or whether it has the effect of reducing the additional services that pharmacies are being encouraged to offer.
Is there an Amazon effect?
I think that's what.
Answer that.
Thank you for summarising my question.
Well, there you go. Themberg, over to you, I think.
Yeah. Thanks for that, Mr. Chairman. It's true. The distance selling pharmacies are providing a key element. I don't have the numbers, and maybe David would know the volume of distance selling prescriptions for West Berkshire. But in some areas, like in Surrey and Sussex, those figures in some areas can go up to around 15 to 20%. And there is a significant chunk of the public out there that is using distance selling pharmacies. But just to add on to that before I pass on to David, is that I think we need to keep in context that, like, say, for the 21 pharmacies in West Berkshire, only 3 were, say, problematic towards the tail end of the year. But the other 18 continue to provide good services across the area. So by and large, the significant chunk of community pharmacies do a splendid job in supporting primary care across the Southeast.
I'm sure they do, absolutely. Unfortunately, it's the 3 that attract the headlines, isn't it? And cause the issues that we're looking at here. Councillor Beck.
Thank you. I feel that I absolutely have to actually bring to everybody's attention, particularly those people here today representing the NHS and various elements. In Newbury, we have the Day Lewis Pharmacy, which is located immediately adjacent to the Strawberry Hill Medical Centre. For many months now, the service there has been deteriorating rapidly. I won't go into everything, but for example, the queues, you commonly have to queue for an hour to an hour and a half. Frequently, and a lot of the people have to stand outside in the rain, the snow, etc. And we're talking about a lot of older people as well. They are not answering the telephones. They're not answering the emails. They are now closed on a Saturday morning, so there's no Saturday morning service. During sort of COVID or just after COVID, they very much encouraged people to use the delivery service. Now, the delivery service has been intermittent, to put it politely. And you can't really find out whether it's working or whether it's not working. to give you one example, I am also a customer there. Last week, my friend went in because I'd got an outstanding prescription which was waiting to be delivered. She went in to sort of seek two particular items, which I was almost run out of. They said they would deliver them. Nothing happened. She went in yesterday afternoon and stood there for about an hour and a quarter. And I was due some 14 items. Of those, 2 were short supplied. 1 was an indifferent dosage and an incorrect quantity. And 4 were not supplied at all. So when I leave here, I'm going to the pharmacy again. The people there are, as I mentioned to some of our members, are getting near to rioting there. It is a desperate situation. And whatever the NHS people can do to actually encourage Day Lewis to improve this, I appreciate they've had a problem with staff. But I mean, you know, for example, why can't they answer the phones or leave a message service on the phones? Why can't they answer emails, etc.? It is a dreadful service. I reported it to my surgery many months ago, but they don't appear to have done very much about it. So I leave that with you, folks. Thank you.
Right. Well, thank you, Councillor Beck. I'm sorry to hear your tale of woe. David, David Dean, can you assist? I mean, is this almost sounds like, to me, having just listened to that, the bones of a complaint to be made. But can I take advice?
So absolutely. Just want to add a couple of things. Online pharmacies. I think it's up to the patient wherever they get the prescriptions from. But you know, as a local representative, I'd fully encourage patients to use their local pharmacy. Otherwise, we will see an Amazon effect, like you did on many independent bookshops. With regards to Day Lewis, Councillor Beck, there's no excuse for poor service. Obviously, I can't condone that. I think we need to work with the local NHS team, with Temba, to understand what is happening in there, and obviously we'll support in any which way we can. In terms of escalation of any complaints, the customer charter, which should be on display in the pharmacy, would suggest that you contact the head office and speak to their superintendent. So the superintendent is like a lead pharmacist for that particular company, whether it's one pharmacy or 500, and they will take those complaints very seriously indeed, especially as it could impact on patient safety and governance. But just a quick comment around delivery services. They aren't commissioned by the NHS. They're done on a goodwill basis by each pharmacy. They're not paid for by the NHS. And you'll see those services start to dwindle, as obviously pharmacies can't afford to do those sort of things for free. But happy to help, Councillor Beck. If you want to contact me direct, happy to assist in any which way we can. That's what we're here to do.
Right. Well, I think we will leave that particular issue with Councillor Beck to contact you, Dave. And I'm sorry you've had those troubles. Temba, do you want to add briefly to that last comment?
No, I was just going to say, I will certainly be following up those general issues with Day Lewis after this call. But if Councillor Beck has specific matters, I'll leave my email address with Vicky, and we'll follow those up. But I'll make sure I get in touch with them.
That's really
on a general note. Yeah.
I've got a note here, Fiona. I notice your hand is up. I've got a little note saying technically we should suspend standing orders. Members, could I ask you?
So proposed, Jim.
Second, right. We've done that. So Fiona, please comment as you wish.
Hello there. Yes, I'd just like to say, obviously, Health Watch would play a role in this. So with regards to the services and complaints, and also positive comments about services, we are here as a statutory body to take on those comments and feed them back to the services. And of course, we do have the powers of enter and view that we can put in place as well, if we feel that we need to. So I think it's very important that going forward that Healthwatch is also taken into consideration on any feedback that's utilised by any of the services.
That's really helpful. May I propose reinstating standing orders? Those in favour? Seconded. Thank you. Right. I think we're just about done. I'm going to end this on a positive note. Perhaps I lead a sheltered life, but I'm blessed to be a patient of the Chapel Road practice in Bucklebury, which actually covers 3 other practices, including Thiel, I gather. And I have nothing but praise for the pharmacy that's attached to that health practice. They work, everything works as it should. They send me messages when prescriptions are ready. So I'm going to end on a positive note that I'm sorry we've had one end of the spectrum where it doesn't work well, but it isn't across the board. Unfortunately, as I said to Temba, it's the small minority that have had issues that attract the headlines, which is why we needed to investigate, because although people may live within the catchment area, if that's the right word, of a pharmacy, I could cite personal examples of people who suffer from mobility. They do not drive a car. They have to walk probably half an hour, 40 minutes, only to find the pharmacy closed, as was the case before Christmas, or it's out of stock, or they then have to wait for an hour. And in terms of the boots in the Thatcham attached to the surgery, queue outside in the rain or the cold. And there has to be a level of service. This is the 21st century. Stand the problems. And I know you're all working to achieve a good outcome, and we can't also wave a magic wand and get it fixed overnight. So I'm genuinely grateful and with a degree of sympathy, David, to what you are doing, and to Temba for attending to tell us what you are doing to assist the public in what is, people are really only going to the pharmacies because they really need that medication that's being prescribed to them. And without that medication, sometimes their health can really suffer. So it is, as you know, a very important issue. Councillor Moore, is that a legacy hand, or do you wish to have the final word?
Sorry, Chairman. Yes, I just wanted to add, during the phase of the pandemic, being an NHS volunteer, I was asked if I would help deliver medications to care homes, and therefore that required going into pharmacies, many and various around Newbury area, and the service I got there as that volunteer carrying medications out was excellent. So I praise for them for that. Thank you.
We mustn't dwell on negativism. I mean, in Bucklebury, we had the greater Bucklebury, that is, we had 80 volunteers who looked after people who were unable to do that themselves as well. And I concur with your comment. Whenever picking up any items, it was always done very efficiently and people pulled together. Let's continue to pull together. Now the pandemic is, I'm going to say over, but we're learning to live with it. So gentlemen in particular, thank you very much indeed. And Temba, if you wish to stay, you're very welcome. If you have more to do in your day job, you're also welcome to depart as well.
I'll go and find Day Lewis.
Right, thank you. David, likewise, thank you.
Thank you very much. Thank you.
Members, item 6 is the South Central Ambulance Services NHS Foundation Trust. So I'd like to welcome our external partners to the meeting, Kevin Tallett, Improvement Programme Director for said outfit, and Ben Voller, the Clinical Operations Manager for the same. Welcome, gentlemen.
Thank you.
To the start.
So, Chair, if you're happy, I'll start, and then between Ben and I, we'll probably flip around. So,
if I may, I'll call you Kevin and Ben, if I may.
Yeah, of course.
Over to you.
Thank you. So, obviously, taking the papers as read, but just to do a quick reprise of where we are. So, the Trust received a CQC well-led inspection of April-May last year. It received the final CQC report for that in August. The Trust was very proactive in terms of getting moving with an improvement programme. So one was formed back in July. The scope of that plan had in its first phase was all around making some immediate improvements, taking action to correct any breaches or near breaches of regulation. We identified in total from the report somewhere around 900 individual actions. And at this point in time, we've cleared 96% of those. So if my maths is correct, about 860. Of the must-dos and should-dos, so within the report, a must-do is a regulatory breach, a should-do is a near miss. We had 11 must-dos. We've cleared 10 of those at this point in time, one remaining, which is an overall one around governance and the application of governance within the trust. And we've completed 14 of the 20 should do. So again, very good progress around those items. We're actually at the stage now of moving into the next phase, which is all around looking to do two things really. One is to meet a set of exit criteria that have been set by the 4 ICBs for SCARES and NHSE region. In terms of meeting those criteria, they've been defined. We have an overall target to aim to clear or at least be assessed to be able to come out of the oversight framework, and I'll talk about that in a second, in September of this year, so the end of Q2. In parallel to that, any other activity that is improvement focused, both medium, longer term, strategic and transformational, are also part of that improvement program. As it stands at the moment, the trust, as you know, was rated inadequate, and we're in something called National Oversight Framework 4, so NOF 4. That's the lowest of the 4 levels of that oversight framework. So for those of you that are old enough, it's the equivalent of the old special measures in that sense. That means that we've got mandated intensive support from NHSE. So there is an intensive support director that's been appointed with the trust on a part-time basis. We're working very closely with that team and the oversight framework that surrounds us in order to make those improvements by the September deadline. So in essence, if I leave that just as the picture, I think for me, I'm quite happy to try and answer any questions. If we can't answer any questions today, we'll take them away and feed them back to you. But on that basis, happy to just pause and see what people would like to ask.
Okay, well, Ben, do you wish to add to anything before that, or over to you?
No.
Right, I see you've unmuted, but we can see your lips move. We can't hear you. Try again.
Okay.
Try again. I fear you seem to have a microphone issue there. Oh, you'll rejoin. Okay. Well, let me ask members, are there any questions for Kevin at this stage? And we'll come back very shortly. I mean, I'd actually like to know, how was your winter? I mean, it hasn't finished yet, has it? But we again, I'm sorry, I do listen to the news occasionally. We do hear horror stories. Equally, I appreciate that there have been various strikes going on at the moment. I'd like to actually know how your staff are coping under quite adverse conditions. Sometimes we hear of huge delays at hospitals. So do you have any up-to-date data as to how your ambulance staff in particular, of course, because that's why we're here and talking to you, how they have coped with the winter issues and difficulties?
So primarily that's one for Ben to answer, if I'm being honest, Chair, and it looks like he's just rejoining because he's the one with those stats. It has been a difficult winter overall. I'll just see if Ben's back, if he can hear us.
Ben, can you hear us now? Now you've rejoined, and can you try talking? Sadly, we can't hear Ben. Thank you for your try. Ben, put your thumb up if you can hear us. Oh, you can hear us. Sadly, we can't hear you, as you gather.
You're still muted by the look of it.
Well, look, Councillor Macro, I understand what you just said, and you said that Ben had the statistics. Perhaps we could, we could ask for those to be forwarded to Vicky, and she could inform us. That is really, Ben, the issues, the difficulties you've had with various strike actions and difficulties with hospitals and how it's impacted you and your service.
Could I just try again? Is that working now?
It's working.
Fantastic news. My apologies. Would you like to revisit the question?
Well,
Chair, and I'll try and answer.
Everyone's had a hard winter. I was asking how your service has coped with the winter, in particular in relation to the various strike actions that have been going on and the extra pressure that has been put onto your staff, certainly discharging patients from ambulances to, in particular, A&E departments. How have they coped and how is morale at the moment?
Yes, thank you. I'm happy to take that, and I'm sure hopefully you can all hear me. You are quite correct. We saw extreme levels of pressure through the December period, which thankfully, if you see in the paper which was submitted ahead of the meeting, we are pleased to see that there has been improvement across a lot of the performance metrics into January compared with our performance in the December. Naturally, industrial action would always be a concern of ours from the perspective of maintaining patient safety. We were fortunate with some of the initial actions that were planned that the impact would be very limited in SCAS due to the low numbers of union members who would be taking action on those days. Of slightly more concern to us would be the upcoming strike action scheduled for the 20th of March, which is pan all our unions. So it is likely to have a far greater impact on service delivery. Naturally, as you would expect, we are doing all we can internally to try and support the operation as best we can in terms of maximising clinical response with those people who hold roles elsewhere in the trust who also hold clinical qualifications to be able to respond to those patients. And we're currently working quite closely also with our armed forces colleagues to see what further support they can offer us during periods of industrial action. But what I would say is it has without doubt been an incredibly difficult time. I think that's been felt across the whole of health, as most winters are. But thankfully, we have had a brief period of respite where morale seems to be ever so slightly on the up at the moment. Hopefully that answers your question, Chair.
Well, thank you. I'm grateful to you. I've got three councillors with their hands up, but Sarah, you put your hand up and I take it, being very presumptuous, that it was to do with my question. So I'll come to you first.
Thank you, Chair. And Ben was able to come in and answer some of that. I was going to give some of the context in his absence, but I would just add that I think the teamwork between the South Central Ambulance Service and the Royal Berkshire Hospital has been or continues to be excellent, and that was demonstrated over the winter. We did see peaks in greater than normal ambulance handover delays that the teams worked through, and the Royal Berkshire responded in ways, creating different ways to enable faster handover. And were also quite opportunistic in offering vaccinations to ambulance staff while they were waiting, for example. So we're nothing but ingenious in trying to get the best out of any situation. So it's really good to see that has now reduced, as Ben mentioned. But I just wanted to comment on the good teamwork there.
I was just going to use that word, and I'm sure that throughout the NHS, it is down to teamwork. We're all working for the same outcomes. It would be very disappointing if such teamwork didn't exist, and I know it does. So thank you. Right, Councillor Macro.
Thank you. A couple of questions. First one for Mr. Tallett. You mentioned that 14 out of the 16 shoulds have been accomplished. So I wondered what the remaining 2 were. Another thing for Mr. Voller, I noticed from the response statistics in our papers that although there seems to be a great improvement in terms of response time, most of them are still slightly outside the targets. I was wondering, how soon do we think we'll actually achieve the targets or undershoot them, please?
So if I do the first part of that and then hand to Ben for the second, if that's okay.
Sure.
So in terms of the items that are still outstanding around the shoulds, they are largely to do with capturing evidence and auditing and things like that on the one hand, and the other hand is in terms of planning to improve the operational performance. It is completing that planning exercise, because clearly that's a a very large undertaking in itself and taking a while to do. We're trying very, very hard to do two things. One is where we are taking actions, we're trying to make sure they are sustainable and can be embedded, and we're trying to gather really hard evidence to do that. So that also takes some time to do it. And the other thing is not to be over optimistic in any of our planning here at all, given the various circumstances, but particularly in the operations space that Ben works in. It would be very easy to suffer from optimism bias, and we're working against doing that. So those are the sort of the areas where it's outstanding. So I don't know if Ben, if you want to add anything in terms of aspirations.
No, but thank you to Councillor for the question with regards to. I think my main question was posed was, how do we foresee ourselves getting back to nationally set performance targets? And I guess now would be a good time to move on to that. I think, Kevin, hopefully you would agree with what I'm about to say, is that ambulance service performance delivery is an incredibly composite beast with lots of moving parts. And I would say to the room today that there's a number of issues that we need to address to be able to drive down our utilisation metrics. So what that means is that we have vehicles available to respond more often. So in very simple terms, that's having vehicles waiting for jobs rather than jobs waiting for vehicles. Now, it will come as no surprise, I think it was also touched on during our conversation around pharmacy, that resourcing continues to be a challenge for us. The paramedic profession has become increasingly desirable across a range of different areas of health, and we're very pleased to see that progression within the profession, but it does mean that we do have some challenges around our clinical resourcing. And of course, then that feeds into our resourcing against our short-term forecasts. Sarah also very kindly touched on the improved performance around hospital handover delays. Now, naturally, whilst we have a very complex and composite performance issues to deal with in the ambulance service, so do the hospital. So as soon as we see difficulties around infection control and things like that within the hospital, and we see those slowing down at the ED department, that naturally falls back onto us. So what I would say is I don't think I can put a finite time on when I expect that Berkshire West will deliver nationally mandated performance targets. But what I would say is we're working very well as a team across health with the support of the improvement programme as well, to try and return as quickly as possible to those nationally mandated performance targets. I don't know if you wanted to add anything else, Kevin.
Just come off mute. So yeah, I think Ben, and for me fundamentally, as you said, it's a case of vehicle availability, people availability. So for the trust in this area, recruitment and retention of staff is always going to be key. And that in itself is a challenge, but that's fundamentally the key issue. It's all about people.
As with every organisation.
Absolutely.
Thank you.
Thanks, Chairman. So the first thing I was going to raise is the CQC, because obviously you've had to be in contact with them and how they're assessing your recovery, really. So I'd like an answer for that. And coming back to the staff, I mean, have you completed any staff services? And have they changes, and have they been beneficial? And the cultural changes that are needed within with the staff. And also very important is the current patient and family feedback being obtained and how it's shaping the services. Obviously, that is important considering the CQC report and obviously delays that we have got nationally as well as locally. So if you could respond to those questions, the pair of you, I'll be very grateful.
Yeah, I'm happy to do that. So if I again go first, and Ben, feel free to chip in. So in terms of where we are with CQC, we now have a regular formal monthly keep in touch meeting with the CQC. They sit as part of sort of observing what's called the tripartite provider assurance meeting, which is the senior oversight meeting for the trust. In that, and observe the feedback from them has been very positive. again, they think that we've made good progress so far in terms of taking immediate action and starting to work on the issues that the report identified. For staff, we held a series of what we called listening events, and we actually spoke to, via Teams, 500 plus staff who identified in 23 different sessions, so identified a number of issues as far as they were concerned, and that's in addition to the annual staff surveys and things that came out of it. So we really wanted to engage with them. We really do want staff to be involved in delivering the plan as well. So the majority of the team have also been pulled from different roles inside SCAS to make sure that they're as close as they can and heavily involved in that program. The listening events identified a number of areas, if you like, or themes that we're working towards as well. So in no particular order, silo working was one, bureaucracy was another, slow decision making, for example, all of those themes. And again, very much linked back to what the report itself was saying as well. So there were no real surprises in there. And I think the staff would say that they weren't surprised overall by the report. I do think, again, though, the report certainly had an impact on everybody inside the trust and almost went through a period of grieving, if you like, for what had happened and where it needed to go. But that focus is very much now on making those improvements and those medium, longer term transformation actions as well. In terms of culture, so again, absolutely right. And that came back from that feedback from the staff. Some of the actions that we've been taking and some of the work that will be ongoing, and obviously delivery of a culture change is a longer term piece of work, but it's underway. But we took immediate action to improve things like the freedom to speak up team, the guardians, and the feedback from there, making sure people had more time available to them to be able to do those, raise issues and concerns. So adjust and learning culture is also part of that. There's been a lot of ongoing work to do with SCAS, what we call SCAS leaders, so SCAS managers and others, in order to make sure that they've got the right skills and capabilities to respond. So big amounts of work done there, but that will be ongoing for a long time. I have to admit, I don't have the friends and family information to hand. So what I'll do is, if you're happy, I'll send that through via Vicky, unless Ben happens to know those numbers himself. But if not, I'll send it through to you. Ben, is there anything you want to add to that?
No. Apologies, I don't have the friends and family, but I know we are imminently about to expect the release of this year's staff survey, which will obviously inform further the kind of developments over the next cycle.
Well, if you're able to send that would be very helpful. Thank you. Councillor Moore.
Thank you, Chairman. I just wanted, in our pack, we've got some figures for performance in January. We've got figures which show it seems that Berkshire West is doing slightly better than the average in England, but I couldn't see what the target figure was. So, for example, category 1, we've got an average in Berkshire West is 7 minutes 31, and the mean average, or an average in England, of 8 minutes 30. How does that compare with any target that's set down as a first question?
I can take that, Chair.
Yes.
Thank you, Councillor Moore. So with regards to our category 1 performance, the nationally mandated target for your category 1 mean response time would be 7 minutes, so we're about 30 seconds adrift. Okay. And then in terms of the 90th percentile, we would expect to get a response to a category 1 patient in 15 minutes. And in terms of category 1, they would be our patients who most urgently need not only a clinical response, but also what we aim to do is provide a transporting resource. And that's quite important, because you will have no doubt seen the solo response vehicles, but also the ambulances. But we do aim to provide a transporting vehicle within that period to be able to take our 6 patients to hospital as soon as possible. With regards to category 2, the nationally mandated mean response time would be 18 minutes, so we're quite a way adrift there. And in terms of the 90th percentile, it would be 40 minutes, although there is debate from January 2023 that the target will be set at 30 minutes for the 90th percentile. So we will have some improvement work to do around our category 2 90th percentile. Category 3 and category 4 don't actually have mean averages, but what we do aim for is a 90th percentile. And in the case of category 3, that should be 120 minutes and 180 minutes respectively for category 4. So what we see is, just to explain this a little bit, you will see that the highest percentage of calls that we see will be in that category 2 arena. And we often do see quite high spikes of category 1 demand as well, which naturally will have an impact on our category 3 and category 4 response, as it is a triage system, which I'm sure you would understand. So it is common at times of high levels of demand, or indeed hospital queuing, where that utilisation or that resource availability drops, that we really struggle to respond to our category 3 and category 4 calls. So I hope that answers the question.
Yeah, that does. Thank you. If I could just do a couple of corollaries on that. That was the January figure. How's it looking since then? Is it generally on a further improvement, or?
I would have to provide some follow-up performance, but what I would say, my sense would be we've had a period of respite where performance has felt better. We stepped down to route 2, but we recently have stepped back up to route 3, which is an indicator of a deterioration in performance and an increase in demand pressure. So I suspect February might not be as strong, but I think March performance so far might be about very similar to this, but I wouldn't want to say for certain. We'd have to provide it separately.
Thank you. Thank you. Appreciate that your collection figures are for the area of Berkshire West. This council is West Berkshire, subtly different. And I just wondered if you've got any sort of indication as to how those performance measures might alter for the conurbation of Reading by comparison with the rural areas of West Berkshire. Is that something that figures are available, or could they be made available?
Yeah, it is certainly something that could be made available. We would be able to look at performance within our performance reporting platform. Yeah, we would certainly be able to look at performance against postcode, for example.
Okay, thank you. Could I just have one further quick question? A quick answer. Just going on to the industrial action. Again, the pack says pay is a matter for government, recognising obviously that the taxpayer funds the service. Who actually is the employer for SCAS staff?
So South Central Ambulance Service NHS Trust, the Foundation Trust.
Is the employment body. Okay, right. Okay, thank you.
Right, any further questions? Right, gentlemen, thank you very much. I mean, if just going from what Councillor Moore was saying, if you're able to give us some more, I'm going to call it, with no disrespect, relevant to West Berkshire as opposed to Berkshire West information, we would be grateful if it's not too difficult to achieve. And perhaps if you could, just to keep us in the loop, let Vicky have any February or March figures. And may I say I wish you luck. Keep up the good work. Continue improving, which I know is your remit. And thank you very much indeed for your time.
Thank you very much. Thank you, everyone.
Yeah, thank you ever so much.
Right. Building Berkshire Together. Alison Foster, welcome.
Hi. Hi, thank you.
Wonderful. Right. Tell us what you're doing.
Okay. I did send some slides. I don't know. Should I just use the share function? How do you normally do it?
We have read them avidly, so if you could just flick through them.
I'll share and talk to them briefly. And I know many of you have either come to the hospital and had a tour, or come to one of the events. So it's nice to see some of you again. I am just trying to see if I can share my screen. Oh, it's disabled. The host can just share.
You should be able to share now.
Thank you. there's not many. I'm, not doing loads of slides. Can you see that okay?
Yes.
Yes, we do.
Okay, so for those very briefly who aren't aware of the hospital and the Royal Berkshire being on the new hospital programme. The new hospital programme launched in 2018. The government commitment is to deliver 40 new hospitals by 2030. And the method or the idea around the new hospital programme is actually, if you've got 40 new hospitals that need to be delivered over a period of time, surely we can, with all the same standards, surely we can standardise some of those things, and we can come together and do things at scale that we be much more efficient. We are in cohort 4, so obviously there's 3 other cohorts in front of us, and that means that we are not due to go to construction until 2025, 2026, and we are currently unaware of our funding, and I'll come back to that in a second. So there's some of the benefits of being on the national programme is that it will be like hopefully a well-oiled machine by the time it gets to cohort 4, learning from what's gone before, and we will benefit from centralised and standardised approaches in a way that the new hospital programme estimate that there's probably cost savings and time savings of 20 to 25% in both areas. So our status as part of the new hospital programme is that we have submitted our strategic case, and we have been over the last couple of years looking at our outline business case. But whilst that's been going on, the new hospital programme have been developing a programme business case, so one that goes to Treasury that encompasses all of the new hospitals, all of the different schemes, and have been putting forward proposals about what that looks like, what the principles will be around that programme, and asking for funding. So what we do know is a funding envelope has been agreed by Treasury, which is amazing. It's great news to hear. We don't know what that is, so we are waiting for an announcement shortly, which has to go through ministerial approval first, and number 10 for scheduling. So I guess, I've been to this committee, I don't know, once or twice at least over the last year or so, and met with people, and one of the things that I think we've highlighted as being part of this exciting process is the frustrating element is just not knowing what the final funding allocation is, so that we can move forward and progress the build. But it feels like the new hospital programme national team have told us that an announcement is coming shortly, and so that will be great news to hear what that is. What will happen after that will be that we will meet with the new hospital programme. So they'll announce the whole programme budget, and we will have one-to-one meetings with the new hospital programme to say, well, what does this mean for the Royal Berks? What does the scheme, what might the scheme look like? What's our allocation? And when might we be scheduled? So we won't, the announcement in itself won't give us all the answers. There will be some follow-up discussions, and then we will be working with the new hospital programme over the next 6 months on a plan to deliver the new hospital in much more detail. So that's where we are at the moment. Our current options remain as they were in the strategic outline case. Which is a redevelopment on the current site, and there are 2 approaches to that, and a brand new hospital on a new site. And so at the moment, what we've been focusing on, and have been over the last year or 2, is looking at our clinical model and our digital strategy. So what that means is we've been doing a lot of work on our pathways, so what they look like, for example, a falls pathway, what happens to a patient from the time they have a fall right the way through to getting treatment and support in the community, and where are the areas that we might be able to improve on that, where might we be able to reduce length of stay, for example, and those kinds of things contribute to what the end hospital needs to look like, so how many beds we might need and what type of beds we might need as well. So we're still working on and refining those details and matching it to how would digital for example, help us to understand what those needs would be. We've been working on our business case, so then even if we get an allocation of funding, we would still need to develop a business case which details that we have done the work with our community and our key stakeholders, gathered the intelligence that backs up whichever our preferred route is, and that has to be submitted via Treasury. So an allocation on itself isn't a necessarily a green light. What it does is it helps us in the business case to understand what we can afford. So we will have to work on the options within that affordability envelope. So we've been looking at, as part of that process, moving from a long list to a short list of options, working on communications and engagement. And just as an addition on there are, you may or may not be aware, but there's certainly new standards for net zero carbon in terms of building standards, as an example, that have come out in the last few weeks that we absolutely have to start building into our programme. So we were in Newbury a couple of weeks ago, and Laura Farris attended and found it really, really helpful. And I think people appreciated that she came along to listen to some of the issues that people in Newbury had. And I can see our colleagues from Health Watch are there. They attended as well with us. And we're just writing up the feedback from that. So the feedback from this workshop does many things. We feed it into the long list to shortlisting process, but there are things that were raised there that might be helpful for us at our service now in the hospital. So we would feed that back, some things in terms of the car parking meter and communications and follow up after outpatients appointments. There were a few issues that actually we don't need to wait for a new hospital to try and fix some of these. We can feed them back to the relevant departments. And our follow up is we will write up the report from that day, but also any follow up actions that we've had, and send it out to the people who attended. And if we've missed anything, they can come and let us know. So some of the things that came out of the feedback, as I've mentioned, some are immediate. There were some concerns around if it moved to a new site, would it be even further away for some people? Travel and transport is massive when it comes to people particularly in West Berkshire trying to access. How can we utilise the West Berkshire facility more? People tend to like that hospital. There was a lot of positive feedback around the West Berkshire hospital. So we need to take these things into account, not just when we're building a new hospital, but what can we take on board now? And the next and last slide really is to draw your attention to the website. So we update this frequently. Every week there's 3, 4, 5 updates a week on what we're doing, and it's really to share lots of the range of things that we're doing, and to try and encourage people, if they want to get involved in something, just to let us know, or if they want more information about something, just to let us know, because what we don't want is it to look so complex that people don't know how to, or don't want to get involved. And we actually want to encourage people to get involved. So we try and be transparent and write about practically most things that we do. So you'll see lots of information on the website. So I'm just going to stop there and see if anybody's got any questions so far.
Well, thank you very much. That was really fascinating. And I do apologise I wasn't around to be able to attend that Newbury meeting, but delighted to hear how, as I know from personal experience, the West Berkshire Hospital is, of course, very important to us here. And the more you can give us there for us to access as potential patients, the better. So much easier than trekking into Reading with all the associated difficulties. You recognise that, I know.
Actually, people come from Reading to West Berkshire. That's how good that's. They know they can park, and it's easy to get in. So it's not just West Berkshire people who like that hospital. It's actually liked by many others that come.
I'm delighted, because that boosts its credentials. I was actually involved in the 80s with the waiting programme when I was on the forerunner to the Health Watch, the Community Health Council, about whether they should rebuild on the existing site in Newbury or the Greenfield site that was always put out there as the new hospital site. So I wish you luck with your decisions on that, because we certainly made the right ones about 30, 40 years ago in West Berkshire, as you have heard repeatedly. So enough from me. Councillor Linden.
Thank you, Chairman. Yes, I was going to ask you, Alison, about the crystal ball, but I think you've answered that. Obviously, the Chairman and myself look forward to our forthcoming visit to see you at the hospital, to be shown around. So obviously would like that sorted out before the elections. That'd be great. I had an opportunity yesterday after an accident concerning an avocado and whatever, to with a knife, to visit the West Berks Community Hospital, and I was well treated. I got there at 9 o'clock in the evening. I put an appointment there because I had another meeting before that, and it was great help with the nurse there. She did a really good job. But what I was a bit concerned about is that she suggested that I contacted my local surgery to see a follow-up visit with a practice nurse. And so I rang up my surgery this morning, and they obviously assured the people as well. And the next time a visit is next Wednesday week, where I really need to see someone in the next couple of days. And I understand they are only funded for emergencies and not follow-on visits, because obviously there are surgeries that have difficulties. There's also problems with pharmacies as well. I know you're a bit late on our call, but it's something that does need to be raised. That's my first question. The second one is, with the delays in the funding decision, has this affected the maintenance and immediate developments needed at RBH? Just really, if you could answer those two, I'll be very grateful, Ali.
Okay. So the funding at West Berkshire for follow-up, I won't be able to. Is that what you're asking? Is there funding for follow-up?
Yeah, I was a bit shocked that
I think Sarah can answer that one, or at least
Great.
she's indicating she might be able to.
Good.
Can I just
Sarah,
bring...
swoop in, Sarah.
So this is something that we are actually actively looking at the moment to clarify this pathway. At the moment, the West Berkshire Community Hospital is for minor injuries only, and generally is a sort of urgent minor injuries, and generally wouldn't do the follow-up. So the advice to go to your GP was the correct advice, but noting capacity constraints in primary care as well. We're looking at this pathway to make sure it's clear, and that applies to sort of wound dressing and wound care post a number of kind of interventions.
Thanks, Sarah. Could I, and the response to this question in terms of your maintenance and development needs at RBH, Ali?
Yes, so I guess the short answer is yes, they have progressively got worse in some areas. Every year the estates and facilities team have to prioritise which is got to be the, where they plug what gap or what hole, but then invariably there isn't enough resource to do all of it. And as an example, if we've had to empty a building because it's not fit for use, the longer it's empty and not heated and maintained, it gets progressively worse and worse. So there are areas of the estate that has those issues, absolutely, and over the last couple of years have got worse, and we have been informing the new hospital programme about those issues as over the last couple of years as well. So yes, that is the short answer.
Thanks, Jim.
Councillor Moore.
Thank you, Chairman. Alison, thank you. I attended the Newbury Matters, and of course, as the member for Newbury Central, I absolutely endorse that sentiment. But I did, in an altruistic moment, wonder whether you were planning others of similar events in West Berkshire. I was quite intrigued by the others around the table I was sitting at who travelled in from the villages around Newbury, and whether there was anything further planned.
So there isn't any at the moment planned, but that's only because we're getting through this shortlisting process, and then we're going to pause and absolutely have some more events. I think they need to be a bit more targeted. We seem to be attracting a similar group of people when we have an event. So we were talking to Health Watch colleagues around how do we reach into different segments of the community to do that. So we do intend on coming back to Newbury to try out different ways of engaging different groups in that area. So, but we haven't got any dates yet, but that's definitely a commitment that we've got.
Good. Thank you very much. Councillor Macro.
Thank you. Yeah, well, I was interested in the fact that the funding envelope has been agreed at Treasury. Have you any idea, any kind of feeling when that might be announced?
It's we've been told. We haven't been told any dates. We don't even know if we'll be told the night before. It's a significant announcement, as you can imagine. It's going to be, you know, I'd imagine tens of billions of pounds. You know, that's a huge announcement. So they're obviously going to manage that very carefully. We have no idea, except that we were informed a couple of weeks ago. It's in the coming weeks. I'm guessing you'll know more than me in terms of political announcements, but perhaps it will be before PERDA, or can they do that after PERDA? I don't know, but it's weeks. It's literally weeks away. It's I haven't got any dates. I wish I could tell you. I wish I knew.
Thank you.
We all. Councillor Bridges.
Yes.
Chairman, thank you. As Alison knows, I couldn't attend the Newbury event because I had a clash, but I did attend the Reading event. And of course, I suspect that the views of the population of Newbury and West Berkshire are subtly different to the views of the population of Reading, who are, most of the people I spoke to were very, very keen on keeping the hospital where it is and redeveloping the site, with all the problems that entails. What I will say with my RBH governor's hat on is that all of the indications are that what can be achieved is wholly dependent on how much is available. There are, I think it won't astonish you that there are a range of prices from basically a wash and brush up of the Craven Road site through to a brand new hospital somewhere else. Not that necessarily that is the desired outcome for a lot of people. A lot of people are actually very keen on redeveloping the Craven Road site. I'm keeping my powder dry because I think there's a range of responses, and the views of West Berkshire residents, I think, come across both things. But at the end of the day, it's going to come down to how much money is available. Fundamentally, that will be the question, and a lot of stuff will flow from that. I think the surprising thing, and perhaps we ought to put just acknowledge this, is that, whether it's surprising or not, is that the state of the Craven Road site basically says that you might think that site is worth a lot of money on the open market, and therefore building a fresh site somewhere else, you can make all this money out of redeveloping Craven Road and throw it into the new development. Not true. The amount of work that will have to be done to the Craven Road site to make it fit for purpose for anything other than the existing use is absolutely eye-watering. So let's not assume that one can pay for the other.
Okay, well, as with everything in life, it always comes down to money, doesn't it? Right. Alison, is there anything else you wish to say in conclusion, or?
No, I think, I have been in touch with actually most of the councillors on that I can see on the screen. So I think that's great, and I think it's good to keep the dialogue going, and to email me if you have any questions or concerns. I'm more than happy to. And Councillor Linden, as I said, we'll try and get that visit sorted out. It's PERDA's next week, isn't it? So we'll need to be swift about that, won't we? So we'll definitely
during PERDA. It's just we
can't announce it and have our photographs and filming.
It's that issue, but
okay. So just before the elections, then. Yeah.
Anyway,
okay.
Grateful to you. Thank you for keeping us updated, Alison.
Okay. All right. Thank you. Bye-bye.
The best.
Thank you.
Social care inquest. Paul, you've waited very patiently. Orco, thank you very much. Over to you for this rather short paper.
Thank you, Chair. As you say, it is a very short paper, and I wanted to just start off by saying why it's short. The first version of this paper was actually had a lot of supplementary information attached to it, but there was a hot debate amongst officers about pros and cons of that. And the prevailing view then is that adding detail creates the risk of insensitivity and distress, hurt to bereaved families of those that are subject to the paper. So we've taken the view that that should be left out. It's come here instead to, well, firstly, to make you aware that there has been increased activity in terms of deaths in which the council has been named as an interested person. And also to say that officers have done work in response to that. In other words, we've pulled together a new panel which meets when it needs to make sure that we are joined up both in our response to the coroner, but also in the learning, addressing the learning or any other challenges that come out of the process. I don't want to create a future booby trap for myself. And I'm still going to say that it appears at this time that this was a spike. It doesn't appear to be a trend. It appears to have been a spike in deaths. And so clearly what we didn't want to do was for officers to know all of this stuff and for it not to enter a member domain in what is, I hope, a helpful way.
That is helpful. I'm sure any questions that members have will be couched in a sensitive manner. Are there any? We can let him off that lightly. It looks like we are. But Paul, I think is regretful. Councillor Macro.
Oh, sorry, Mr. Chairman. It's had a difficulty moving the mouse. It's I think Paul has answered us really, but have we any feeling as to why we had this kind of surge and after? Is it because we've had more deaths, or is it because the coroner is taking a kind of more robust attitude, shall I say?
So I don't know the answer to the question. There's a data gap. If you see, where the paper says essentially the spike has been in those cases where we are an interested party. I suppose the other thing that I can add is that upon reviewing all of the various deaths, there is no single common theme, that they were people in different places, settings, circumstances, ages, different causes of death, etc. So as I say, that's what makes me think that it's a spike. It's more like a spike than a trend.
Thank you. That's reassuring. Thank you.
It is indeed. I'm looking around. There aren't the other hand. Paul, thank you very much for that presentation. If you wish to remain, you're obviously welcome. And if you wish to leave, then equally welcome to do so. Item 9, Integrated Care Board update. Sarah, you have interjected occasionally, but otherwise been waiting very patiently. Over to you.
Thank you very much, Chair. And I'll treat the pack as read and just pull out some highlights. So again, just a quick reminder of who we are, because I know that the health landscape is quite complex, and apologies to colleagues, particularly Paul, who's probably heard me go through this about 30 times now. But in a nutshell, I think you could probably split the NHS into two camps: providers and those that do the strategic commissioning in the background. So the landscape around our providers, so our hospitals, our GP practices, our ambulance providers, hasn't changed. More recently, though, the landscape around the strategic commissioning side has changed. Historically, this was managed by what was Berkshire West CCG, looking across the Berkshire West patch covering West Berkshire, Reading and Wokingham. And from July, we have amalgamated with Buckinghamshire and Oxfordshire and are now the BOB, Integrated Care Board, covering the broader geography, with a really important focus still at those individual three, what we call place areas, and I'll come on to that in a bit more detail in a moment. My role, I'm the lead director for the Berkshire West part of BOB, so that's kind of where I fit in the whole structure. So I'll talk on a couple of the broader Bob initiatives at the moment, and then focus on some more specific areas of interest to us here in West Berkshire. So first of all, I wanted to touch on our strategy. So across Bob, we've got the Integrated Care Partnership, which is a partnership of the local authorities, us as the Integrated Care Board, our provider trusts and other colleagues as well. And we've just finalised our ICP strategy. I should note as well that our good Councillor Bridgman is on that Integrated Care Partnership Board as well, so he's very familiar with this detail. And the strategy was built on an amalgamation of the health and wellbeing strategies across the 3 place areas. And so it should be very familiar to colleagues and members of the room. And so it went through an extensive public consultation period. The window closed at the end of January, and we've reflected on the feedback received and published what the feedback was and the action we've taken to consider that in the strategy. And the final strategy is due to be published imminently. So I was this week potentially. So that's the strategy on which we across Bob will be hanging off the work that we're doing to a greater or lesser extent, depending on the local priorities, both within our places and then within the place. So at a West Berkshire level, for example. So it's a guiding strategy to help us, but really very much built on our health and wellbeing strategy that is already in place here across Berkshire West. Within that, we then have to, as a Bob ICB, we have to prepare a joint forward plan. This is a plan that we have to prepare annually. It's technically an NHS plan, so it's how we as an ICB and our NHS provider organisations effectively are going to deliver on our commitments within the strategy over the next 5-year period. And it's refreshed every year. So we're going through that process at the moment, and there's again ongoing engagement work with our partners. And I think this is something that will be an evolving document, as all good, useful plans are, and again need to be very much complementary to the plans we've got around delivery of the health and wellbeing strategies. So this is a chance for us to coordinate a lot of that, make sure that we're clear on where we're going, and making sure that the work we're doing as the ICB is delivering on behalf of the needs of our local residents, and so help us kind of keep making that check back to what the impact we're having. So we're working through that at the moment. It'll be published in July, and we've got a session at the Health and Wellbeing Board steering group, our next steering group, to have a bit of a discussion on this as well. It's on the agenda. So really keen to share that and continue with that engagement. And I do really want to reiterate, this is not in addition, this is complementary to existing strategies and plans, and isn't meant to be another layer on top of what is already quite a complex environment, as we're all picking up throughout these discussions. So I mentioned earlier that we're then also focusing on Berkshire West as a place. I know that terminology doesn't land with everybody because Berkshire West isn't a place to the general public. It's what we use as a health construct. But I will use it for clarity in this conversation. So we're talking about what we want to do and how we want to gear ourselves up to work in partnership across Berkshire West Place between health and social care, so that we can deliver on our strategies and our plans. I guess a reminder that we're not starting from scratch here. So across the Berkshire West patch, we've been working closely between the organisations, and there is a good history of joined up working. So we're not starting from scratch, and there are some areas nationally where this is a bit more of a step change really in terms of that local integration that we have here. But there's work underway at the moment. We had a good sort of senior officer workshop last week to discuss what are the areas where we think we can only really make progress on behalf of our residents by coming together and working in partnership, even if then implementation is managed and overseen at a local authority level. So a really good initial discussion, and we're going to be taking some of the feedback from that. Paul and I will take it to the steering group, again through the Health and Wellbeing Board steering group, to get some further input in this, and also to consider how we make sure we get the right input from members and colleagues from Health Watch, voluntary sector organisations into the partnership, and how that might work going forwards. So I think the really important thing is that we need to make sure we're an accountable partnership board delivering on behalf of our residents with tangible output from the work that we're doing. And if we can keep hold of that sort of golden thread through all of our work, then we're very much on the right track. So that's a very quick whistle-stop tour around the kind of the context setting and the broader work we're doing at the moment. And then I just wanted to have a focus on 3 specific areas of interest to this committee around the urgent care centre in Reading, the adult social care discharge funding for the current financial year that's due to end at the end of this month, and then a quick touch on the NHS Continuing Healthcare Transformation Programme. So first of all, we're currently running a pilot urgent care centre in Reading. So this is an urgent care centre for people who have urgent but not emergency physical health needs, so illness rather than injuries. So that's a distinction between the Newbury facility at West Berkshire Community Hospital, which is for minor injuries. This is for illnesses that require an urgent response. It's based in the Broad Street Mall. It's been open since early December. It's an 18-month pilot to see if this service really helps to meet some of those urgent care needs of our population, and take some of the pressure off the emergency department that are currently seeing increasing numbers of people turning up with minor illnesses that may well appropriately be treated elsewhere. So within the urgent care centre, it has capacity to see up to 100 patients a day. And generally, we've split that between 50 self-presenters, so 50 people walking in, 50 people referred from either emergency department or primary care. So there is the potential for someone who may go to the emergency department to be appropriately redirected to the urgent care centre if their needs could very easily be met there. At the moment, as I said, it's a pilot and we'll be evaluating the impact of this. We are currently seeing lower utilisation than we were expecting. So we're not using the full 100 slots every day, despite there being some ongoing pressures, as you'll all be very familiar with in terms of the emergency demand. So we're looking at why that's the case. Is it because it's the early days of the pilot and it will get more embedded and established, or is there more we need to do around this? So we're putting out a lot of comms to the public and appreciate any support in this to let people know that the service is there. Clearly it's in Reading, which I know we've had feedback from people in West Berkshire that that's not always the easiest place to go, but then equally some people who would have been going to A&E, travelling to Reading for that service, alternatively would be encouraged to go to the urgent care centre instead. It's open from 8 a.m. till 8 p.m, 7 days a week. So we're also seeing that we often get more demand for this service on the weekends when people may be struggling to get appointments with their primary care GP provider. So we're going to continue to review the impact this is having and making sure it's meeting our residents' needs. And we'll be able to update at a suitable point in the future as we determine what our long-term plans are following the end of this pilot. We also then wanted to quickly touch on the discharge funding and the arrangements we've been discussing over this winter. So there was a national £500 million fund announced sort of late last year to support adult social care and in a nutshell supporting people to get home from hospital or to an appropriate setting for their care needs. But what I did want to just have in the slides is a reminder that there's a whole host of reasons why people sometimes may be delayed by leaving hospital. It's not solely adult social care. I think that's often an unhelpful narrative, but it's the area that we were focusing on, particularly with this funding stream. And it's been very helpful. So West Berkshire was allocated a total of just shy of 1.2 million to be spent over this winter by the end of this financial year. And that's gone to a number of areas around additional domiciliary care packages, home care, social worker capacity, and really helping to support the adult social care team. And I'd hope that Paul would nod along in agreement and say this has been a good example of where we've been working together in partnership and joint planning. Excellent, I can see a nod. And at the moment, we just need to evaluate the impact that this funding has had to make sure that those services that have really had the biggest impact are able to continue into next winter as we're planning for how we meet the demands of the winters coming. I should also just caveat that the data in the pack is historic, so that stopped being recorded nationally and publicly in 2020. So that's why there's the time lag on there. We no longer nationally report the delayed transfers of care data. That's not restarted since the pandemic. And then finally, just to touch on the third area of local interest around NHS all-age continuing healthcare. So continuing healthcare, as I've noted in the pack, it's where the NHS funds an ongoing package of care because the individual receiving that care has a primary health need, causing the need for them to have that ongoing care. It's not condition or diagnosis specific and requires it requires a level of assessment before someone is deemed to be eligible for continuing healthcare. Since the formation of Bob ICB, this is an area that we've identified as an area we wanted to focus on to make sure that we have a level of consistency in reducing variation in patient and carer experience of this service, and to make sure that we are delivering a consistent model of CHC across Buckinghamshire, Oxfordshire and Berkshire West. And there was an LGA review here in Berkshire West that identified also a number of areas that we want to improve on going forwards, particularly around relationships and the ways that we approach this with local authorities when we're looking at who should be funding what and how can we streamline the process and improve the experience, not only for the people receiving the package of care, but also for our teams involved in this who often find themselves having discussions around funding that ideally would like to avoid and make the process a bit easier. So we've got a transformation programme established with colleagues from West Berkshire involved in that, along with our other local authorities across Bob. And we are undertaking a comprehensive review of our CHC operating procedures and also our policies to make sure they're clear and appropriate and consistent. And we are in that phase at the moment. So we're just finalising the recommendations by an external transformation team around what our operating model should look like going forwards for CHC, which we will then take forwards. And we've also got an additional focus here in Berkshire West around how can we clarify the joint funding arrangements. So that's where someone who may not be eligible for full NHS continuing care, they may be jointly funded between the NHS and the local authority. And we've agreed to, and we have been undertaking work with colleagues from West Berkshire and Reading and Wokingham to have a look at a joint funding policy that we want to put in place to make that process clearer and easier to navigate for everybody involved. And we're looking to, we have a target date to trial the implementation of a new policy from April. That's what we're aiming for at the moment, subject to appropriate approvals and potential funding being identified if needed. So I appreciate that's been a whistle-stop tour around a lot of areas. I hope that was helpful. I'm very, very happy to take questions if there are any in the room.
Very comprehensive and very interesting, and indeed whistle-stop it may have been, but packed full of information as always, Sarah. Thank you. Councillor Macro.
Thank you. Thank you for the last piece about the continuing healthcare. Sounds a little bit promising from the problems we've had over the previous years. But I want to ask about the urgent care centre. When that was first announced, there seemed to be a lot of confusion on social media, and I found I couldn't answer the question, which I found frustrating really, as to whether people could just turn up or whether they had to make an appointment. And I think that might be one of the reasons why the utilisation is a bit lower than you anticipated.
Okay, thank you. That's helpful feedback, and we've been trying to collate that sort of feedback. So for clarity today, yes, we are expecting people to be able to access the service just by walking in. We do operate an appointment basis, so it may be that you arrive, and if you don't, you'll be triaged. If you don't need to be seen immediately, you can be given an appointment slot and asked to return within a reasonable period of time, which we hope is a better model than having to ask someone to sit in a waiting room for 4 hours in A&E. And we've had good feedback on the fact that we have that flexibility. But I'll take that away to bear in mind in terms of the communications we're putting out going forwards.
Thank you.
Any other questions for Sarah or comments? Sarah, thank you as always.
No, thank you.
Health Watch report, item 10, Fiona, it's your time.
Hello there. It's very short, so I will be very, very brief indeed. So basically in West Berkshire, as you know, we have a new team in, or you may not know, actually, we have an interim lead officer, which is myself, and 2 new members of staff. And we are just at the moment undertaking a project called Thinking Together 6. So we've been meeting with students at Newbury College to find out what their experiences and thoughts are of the mental health support services in West Berkshire are and have been. And we will also be holding an online parent care event tomorrow evening for exactly the same reason, to find out what the parents' views are on the mental health services available in West Berkshire. So that's what we're currently up to at the moment. So as I say, it's very short, very brief.
Well, don't apologise for that. We're always grateful, but thank you indeed. Questions, members? We're going to let another one off lightly, are we? We are.
Well, thank you.
You indeed. Now, task and finish group updates. Councillor Macro first.
Thank you. The task group on continuum healthcare has basically been put on the back burner pending the review that's going on. I didn't see much point in kind of dragging people into meetings when they're already working on the issue.
And I'll comment briefly on the new developments task group. We have met to establish various parameters. Understandably, the team required to participate most in this is rather tied up with other things at the moment, but I'm sure the work will crack on imminently. Which leads us neatly on to item 12, the work programme. Members, I just ask you to note it. As always, we're always open to suggestions anyone may have for future topics. Vicky, is there anything else you think I should add or you wish to add to that?
Just any suggestions would be welcome.
Yes, please keep coming up with suggestions. I think it's useful to wear these topics as we have found today. And even if there are no answers available, at least it gives us the understanding, does it not, as to what the issues are and where we can direct, where we can direct any issues to, I think, which is the important thing. It's not knowing all the answers, it's knowing where to find them, I think, or knowing the person who can give us the answers. So I think with that, I will note that all our business has been concluded. May I thank you all for your attendance and indeed participation. I think this is obviously the last one, is it not, before election time? So therefore this will be the last time that I chair it. But it's been a short but pleasurable experience indeed.
Chairman, can I just thank you for your chairing, and I'd also like to thank Claire Rolls in her absence as well, and also thank Vicky for her hard and dedicated work, supported by Gordon Oliver. And it's been great working on this committee for the last 4 years. And also like to thank Councillor Bridgman for his input, and others as well who've been very, very helpful, some of whom are not here today. And I wish everybody well after next May. Thank you.
So could I just I'd say I agree with absolutely everything that Tony just said. Thank you very much.
Yeah.
Yes, don't underestimate Vicky. Without her, this wouldn't go ahead. Anyway,
it wouldn't, no.
The piece of paper that I've been working off with all the highlights on has been exemplary. Yes, she does a fantastic job, I do agree. So, members, I will ask if you just remain seated until the Zoom is finished. I'd be grateful.